In my prior videos, part 1 through 4, I talked about how my husband Ryan entered the hospital on November 21st, was forced onto a drug against his consent, a drug with a known side effect of kidney toxicity, and was forced onto a ventilator on November 30th while having a normal 98% oxygen level. What followed was a lot of lies and manipulation coming from the medical staff, leaving me with the question, if they were not wanting Ryan to stay on something that he was improving on, if improving was not their goal, then what was? If the fear of losing Ryan was not the concern, then what were they afraid of losing? Then after an emergency medical hearing with the courts, left me with the judge saying he had to let the hospital doctors make the call for what is best for Ryan, I was left on my own to defend Ryan's rights and find doctors willing to put Ryan's needs first. Now join me as we go into part 5. After being in the hospital and having several nurses openly tell me that they are not allowed to fight for Ryan or they will lose their job, everyone blaming politics for controlling the healthcare system, saying their hands are tied, it was then that I decided to look up our Michigan state laws on recording conversations to see what I would be working with. It was then that I decided to be proactive by secretly recording my conversations with the staff. I thought when Ryan wakes up, I can show him just how much I had to fight for him, as no one would believe me this is going on in the hospital system. They are openly denying the right treatments to patients for job security. This is a nightmare. This is like being in a horror film. I feel like we are being trapped by criminals. I get to the hospital and met a new nurse there that day. She told me that she was with Ryan when he first came in. It was then that we sat and talked and had this conversation.
And I was always hoping I'd be able to meet you. And then when I came in today and they told me to have this room, I didn't say a word. I was like, I was very happy to take care of him. And like I said, it was nice that I could meet you too, because I always thought to myself, if something ever happened, would I be the one to call you and be like, I know you don't know me, but I was, it's just those little things, you have people on your side, believe me, you do.
Yeah, there's been quite a few nurses who have come in and said things like that they've were on our side of trying this. So,
I'm sure you have quite a few that are okay saying it.
Yeah.
Some aren't okay saying it.
Yeah.
I've been here 20 years. I'm going to say what I'm going to say. If it's going to cost me my job, you know what? I can go somewhere else and say what I'm going to say.
Good for you.
That's just that right is right. And take an oath, like you said.
Yep. Good for you. I can highly respect that way more than the ones who are staying quiet and know they're doing wrong and doing it anyways for a paycheck.
I always tell people, whenever you feel like, because we get burned out, we get feelings too, we get angry, irritated, whatever. Mm-hmm. But you got to check yourself and you got to say, what if you were in those shoes?
Right.
And once you put yourself in those shoes, everything is different.
Yes.
You know what I mean? So I've put myself in those shoes many times to know that I don't have to put myself in those shoes anymore. I'm going to do the right thing. Okay. You know what I mean?
Yeah.
And I'm going to see what I can do.
And I tell you, I used to hear these stories all the time about how bad protocols were, and I was helping people trying to fight around it. And now I'm in those shoes. Mm-hmm. And I'm like, holy moly, everything they said was true and much more. Yep. And so I'm like, this is a living nightmare. I hate to say it, but I feel like right now, anything that's considered a COVID protocol is like a death camp. I hate to say it, but they're literally watching patients just die. they're not helping anyone get off anything, and they're not helping them get better. There's nothing on his IV setup right there that's helping him to get off this.
Yeah, I agree. I truly agree. I think that's the scary part, is because this is bigger than us, and there's some agenda going on that we are trying to like not believe that it's something, but how can you not? How can you not think for 1 second that there's way more going on than we know?
Right.
And I'm not in like the conspiracy theories and stuff like that, but I am a person who will analyze everything before I make a good decision on my own.
Right.
I will have to see things. I will have to read things. I will have to talk to people. I already kind of know. You know what I mean? And I just don't understand. I just can't understand what's happening, you know.
Right.
It's tough for everybody, you know. It is. But I want you to know we are going to fight for him. This is Reglan. This is kind of helps the stomach and stuff like that. And I'm just going to do this real quick.
Have you ever had anybody fight the hospital in court and win for that?
Not yet. Not yet. I do know, actually, that there's a few people, the way you are right now, they're fighting for their loved ones to get the ivermectin.
I had heard it was from 17.
Oh, that I don't know. Yeah, that I don't know, because I don't work here all the time. I float around. That's why I got to know him, because I was over there, and then I come here, and you know, and I don't know when it was or whatever. At 17, it could, you know. Yeah. Like I said,
I was hoping to run into them, but I never saw anybody coming out that way. But yeah, I thought, man,
I'm not really sure. It could be.
Okay.
But I just know that I've heard that there's a few families. I didn't realize you guys were one of them, though. Now that we're talking, not that you guys are like, you know, trying to sue anybody or anything. You're just trying to get the right thing for your husband, and I'll tell you, I don't blame you one bit. You're not at fault. You're doing the right thing.
Oh yeah.
In my eyes, you're doing the right thing.
Somebody's life's on the line, and that's all they have as an option. You know, you're gonna try it.
Absolutely.
It doesn't hurt to try anything.
We don't give up. We should not be giving up. We shouldn't be taking that for an answer. No is not an answer when we have options.
Right. Right.
So I hope that, I'm glad that we talked. I hope that I can give you some more information and kind of help you with the whole route. One more route you can go to try, at least, you know.
Yeah, so I'm kind of like on the fence of like pulling them out and trying to go to like a long-term care facility is another option, and seeing if we can have better odds there to do it and try it there. Because I just, you know, I feel like I'm at a standstill with this hospital if they're not going to let him try every avenue.
Yeah, I agree. But what I was thinking to tell you is, I'm wondering if the way you can get around it to get it is just that, bringing in his home meds. Do you know what I mean?
Yeah.
If you say, here's his home meds, I don't know who I could talk to about this.
I mean, literally, it's a difference of a life and death for him, honestly.
Yeah.
This is it. I mean, this is his chance. I think he should have, like, the right to try this for him, and if it has that 90% turnaround, like the doctor I spoke to said that you'll see the biggest change in just 24 hours of having it. And then he says by day 2, you'll see even bigger. And it's like there's a story of a guy who came from Hong Kong and went to Chicago to visit his granddaughter, got COVID, was in the hospital in Chicago, was on, death's doorstep, nothing else they could really do, was on vent 100%. And his wife was a doctor, and his wife pushed for that ivermectin. The hospital wouldn't do it. They had to go to court. They, went through the attorneys. The judge overruled and told the hospital they would have to give it. They gave it to him, and by day 3, he pulled out his own ventilator because he woke up that much and was able to breathe on his own and didn't know what was in his throat. So,
yes, right.
Which is not good either, but...
See, I just have a hard time with if they know it works, why wouldn't you try? But I'm wondering if the loophole is, well, they're not going to order it, but if he has a prescription and it's a home med, maybe it will fall under there. Do you know what I'm saying?
Yeah.
I'm gonna do what I can to kind of help you. I'm sure you've done probably everything. It sounds like you've got, all your numbers together and whatever. I'm wondering if, I don't even know if ethics got involved, because we have ethics in our, when there's ethics decisions being made, usually it's the doctors say hospice and family says no. And, there's nothing else we can do, but there's ethics are for all different reasons.
Right.
There's gotta be a way. There's gotta be a way we can get this. I have a hard time with politics too.
Yes.
And, most of us nurses and staff, we're all about what the patient needs.
Yeah.
We don't care about the politics because we already have our own issues with hospital politics.
What one person had told me, they said it was because it's not a FDA approved for the COVID protocol. Well, he's not COVID anymore.
Right.
So why aren't we just treating him like a regular patient? And when we asked, do you ever use off-label drugs for other things? They wouldn't answer that, which I know that's a yes, they do.
They do.
They do. And so then they said, well, it's, they said it would have to be, the FDA approved treatment protocol. But if we want to be technical, the NIH.gov Article 2E lists remdesivir as the first thing of choice for treating it, ivermectin second, and third was a steroid of some sort. And so when I mentioned that, they said, well, but it's not FDA approved. I said, neither is remdesivir, but you use that. And it was like, quiet. So, I mean, how can you choose one and it's not the other? It's you either don't do it or
you do it all.
Yeah.
Yes, I agree. Oh, God. I know. This is frustrating.
So then I said, well, we sometimes go by the CDC and other things, what they say. And I asked, well, do you go by the World Health Organization? And they paused, and then they said, well, yeah. And I said, well, then okay. Well, the World Health Organization warns not to give them remdesivir because it's more fatal than the virus itself. Yet here we are. And so why was that okay? But you won't use ivermectin that has like the risk of diarrhea, headache, maybe a fever too.
Yeah. Well, yeah.
I'd take that over this. Any old time.
Absolutely. I'm just wondering what their fight back is. Is it because maybe that's secure? Do you know what I mean? I've been doing this 2 years. I have seen things and I am just sick of it. We need some answers, and why aren't we trying?
Yeah.
So I'm right with you 100%.
I took it when I was sick and it got better right away. My mom had it too, and she was really sick, real sick, like almost at the level he is. And I thought she was like 2 days away from the ER, and I thought, oh my gosh, another nightmare, another one with protocols. It came in time. We put her on it. By day 2, such a big turnaround. I mean, she went from no voice at all, could barely talk and catch her breath, to day 2 sounding like perfectly normal. And I was just like, are you kidding me? The only thing she still had was her cough lingering, but she said she could breathe now. Everything was starting to open back up. And so I said, okay, well, now we got something a little bit better here. Let's keep you on it. And she had to take her case. She was 18 milligrams for 5 days. And then once a week after that for like 2 more weeks. And by day 5, she swear nothing was ever wrong with her.
And you're in contact with the doctor that prescribed this,
and
he's kind of giving you like statistics of what he's seeing.
Yep,
and
so like 90% recovery rate, 90%.
How can anyone deny that? It just makes me crazy.
Yeah, and he has too much to live for, and me and him are high school sweethearts. We go.
What high school did you go to?
Light and Life Christian.
Okay.
So we met in a private Christian school, and I met him at age 15. So we've been together a long time, 25 years together. Married 13. So I'm not giving up on him. I had a doctor here tell me that his heart could stop at any moment. I rushed over here thinking that was it. Almost got in an accident to get here. I get here and the nurses are acting like everything's fine. I'm looking at his monitor, it looks good, and so confused. They didn't know why he told me that. They said, well, why did he say it that way? They said, they're telling you like the worst case, but we're not in that situation right now. And they weren't too happy.
It's really how we've been struggling with these doctors. They're not doing, not all of them, but they're not, and they're leaving us to talk to the families, and they know that we can't, there's a lot of things we're not even allowed to say. It's out of our scope of practice.
Yeah.
And then the families are getting upset at us because you know, what are you guys doing then? And it's like, exactly, the doctors need to come talk to you.
Yeah.
And do things, and, you know.
Well, like I asked one nurse not just earlier this week, I said, what is it that you're giving him here that's helping him get off of that vent? And she said, there's nothing. There's nothing that they can give that's going to help him get off that. And I said, okay, so your protocols that you follow are doing nothing to help the patient, but you're not allowed to give them anything else because nothing is the best option. Am I understanding this right?
Yeah, no, you're right. It makes no sense at all. It makes no sense at all. I'm gonna see what I can do to help too a little bit, at least try to get somebody you can talk to about what if you bring in his home med and give it to him as a home medication.
Yeah.
You know what I mean? And if you got it filled and you brought it to the pharmacy, and then we dispense it as, you know, given, as however we're supposed to give it, as part of his home meds.
I wonder if, would they even allow me to do that? Would they allow me to give it to him through a feeding tube?
If we had like the law and like involved like ethics and everybody, and we had to put things in place where they would be afraid of liability or something, absolutely.
Because I've heard of some places doing that,
They
you know,
could, yeah.
where if you were able to give like over something that was over the counter, that they take from home, that they were able then to go and give it themselves. So I thought,
Yeah,
well,
I mean, I haven't seen it, but I don't think it's impossible. I think that if you just got the right paperwork in place, anything's possible, right?
Right.
It's possible. But even if they could just put it under his home med and just shut up and put it under his home med, we will give it to him. As simple as that, you know? But I don't know if they were afraid that if they were to order it and give it and from the beginning, and they know that you have the prescription, right?
yeah,
See, so the fact that somebody didn't say, well, if you have it filled and bring it in, you know,
yeah.
I'm sure they've got guidelines, but if it's a home medication, you cannot deny him his home medications.
Yes, I would think so. Yeah.
I'm gonna fight for you guys. I am gonna fight for you guys as much as I can fight.
Yeah, because I would think there'd have to be something in patients' rights, you know? Isn't there something in the patient's rights where they'd be allowed legally to take their own medication?
There is, and you are next of kin.
Yeah.
So you're making the decisions for him when he can't. So
Right.
you are his eyes, ears, mouth, knowledge, everything. So we would have to, technically, we would have to do everything in our power that you guys want. And to me, that's a big one. If that's going to save his life, why wouldn't you want to save his life?
Right.
And if it doesn't change anything, it's
you're
not
no
going
better
to
off.
it's not going to hurt him.
Right, exactly.
It's not going to do nothing, or it's going to do something.
Right, exactly.
Why would you? Stacey, I'm going to get all riled up.
I've been there. I keep telling myself
Bless
I'm
your heart.
not getting as mean as I want to be because I don't want to be kicked out of my
I know. Listen, if you need to shut the door, scream, cry, or whatever, I will do that with you. Because most of us know that the frustrations get taken out on us, but we know it's not personal.
Right.
And we want to see these people do well. We do. I mean, we're sick of this. We want to see some progress, you know?
Oh, yes.
But I am definitely gonna see what I can do. Even if it's calling ethics on your own. Because ethics will
Step in. Do they have like an ethics group that's outside of the hospital that would ever step in? Because they might have more of a pull.
Yeah, and I think, I know what you're saying. Like, if you get ethics here, they might already be on this side of supportive of the doctors.
Right.
Just
And to keep their jobs too.
Ethically.
Right.
It's supposed to be ethics, you're not supposed to. But with everything that's going on in this world today, you gotta kind of think what's best for you and him.
Right,
You know, and
exactly.
if you can get ethics outside of here. Do you have a lawyer?
I do.
Or know a lawyer? Call them and ask them maybe, just get some lawyer advice and say, if I was to get an ethics group, can I do that? Sometimes someone somewhere knows somebody, you know?
Right.
But we have that here. it's worth a try to even just find
Yeah,
out.
see what they say here,
See what
and then
they
I can
say.
always try to see what they have outside of here. And
After she left the room, I was left to sit and take in everything that was said. I am happy she is fighting for him and willing to speak up. The world needs more nurses like her. But as for the vast majority, wow, to take it all in, that they know they are not doing right by these patients, and yet my husband is another victim on just another given day. Where is the empathy? Where is their oath to first do no harm? I was still on the mission to find doctors willing to fight for Ryan's life and listen to our request. We do not want to be on this protocol. Why are they forcing this? And who can help my husband try something else? May God help me defend my husband. I place my hand on my husband's head daily, asking for our protection, and for God to please lead me to someone who will help fight for my husband. Follow my page starting with part 1 as I begin to take you on my journey from the last 3 years, and by the end, you can decide, was this hospital guilty of negligence or solicitation to commit murder?
I will fight for you. I will see you through by the power of my spirit, says the Lord.